I'm Dr. Edward Lanieski, board-certified orthopedic surgeon in Brighton, Michigan. I've been involved in cell-based therapy since 2005 and have done over 4,000 of these procedures. I've had the wonderful opportunity of getting to know some of the best researchers, some of the best patients, some of the best people involved in cell-based therapy since 2005. I'd like to share that with you so that you can understand where we were, where we are now, and where we're going. So join us in Profiles of Cellular Healing. So welcome to Cellular Healing. We're going to talk with experts across the world today about regenerative medicine, about cellular healing. And we've got somebody today who's very positive, Dr. Siddharth Tambar. He's at the Chicago Arthritis and Regenerative Medicine Clinic right down in Lincoln Park, Chicago. You can reach him also at chicagoarthritis.com. And he comes from a very interesting background, and this is why I had him come on. He's becoming a good master at social media. He's put out a lot of videos recently, a lot of them positive, a lot of them thought-provoking, and that's why I wanted to bring him on today. And the interesting perspective that he comes from is that he's from the world of arthritis. He's a rheumatologist, and he got interested in true orthobiologics, not pharmaceutically made orthobiologics, and got involved with this, and he's got some really good perspectives. And so we're bringing him on today to talk about some of the positive things that we've seen with regenerative medicine, and to keep us all truthful too in this whole perspective of what we can tell patients that is true about this treatment and who may be the best people to treat with it. So Dr. Tambar, why don't you go ahead and tell us a little bit about yourself?
Yeah, thank you very much. So, I originally got involved in regenerative medicine around 2008 or so. I was finishing up my rheumatology fellowship. I got super interested in musculoskeletal ultrasound roughly in 2007. For me, that was eye-opening, partly because it really got me interested in tendon-related pathology and some of my own issues, but certainly in other patients as well. And it also made me understand anatomy in a much more dynamic and three-dimensional way. As I started to go down that rabbit hole, I got interested in what are other treatment options that are available. For tendon-related issues, that got me interested in platelet-rich plasma. And as I started down that path, I started getting interested in bone marrow-derived stem cells for osteoarthritis treatment, and then sort of onward and further into the rabbit hole, down the rabbit hole.
And so tell us where you're at right now. Tell us about your center, what you're doing.
Yeah, so recently moved my clinic down to the West Loop in Chicago, that's downtown, with the intent of really growing out things in a more professional and appropriate manner for the next 10, 20 years. I think regenerative medicine and orthobiologics is really just starting to take off. If you look at where we were 10, 15 years ago to where we are now, it is night and day. I remember when I first got started in this, to find somebody else who had an interest in just platelet-rich plasma, that was a hard thing to find. I mean, you had to really hustle. I remember when I first got interested in this, I could not find anybody interested. I found a listserv that was for the American Association of Sports Medicine, which was really only for people who are either board certified as primary care sports medicine or orthopedic surgeons. And they had people who are interested in platelet-rich plasma. And so I had to convince the listserv administrator to let me on that listserv. And so I somehow snuck onto that, and I just bombarded them with questions about how to do this, how to do that. And I was like just hyper motivated to really learn more and more about it at that time. And you compare that to now, where, I mean, there are a number of international meetings where you can meet world leaders who've been doing this for 15, 20 years plus. The number of resources available to get trained in this properly is plentiful. It's night and day difference. So while orthobiologics have been around since the mid-90s, the reality is they've just taken off in terms of interest and data and literature over the last 10 years. And I think as patients get better educated, as physicians get better educated in terms of what works, as regulators get more comfortable with what we're doing, as payers get more interested in terms of cost savings, I think this will only continue to grow over the next few decades.
Yeah, I agree with you. Just when I started, I was down the street from me at University of Chicago, and my lab was moved to an oral maxillofacial surgery fellows. We had a share, and they were the ones that were studying it. Nobody in orthopedics. And so when I got out, she said, "Well, why aren't you using this in orthopedics?" I'm like, "I don't know. Why am I not?" And so when we got out, we started doing that. And I worked on the GPS-2 system that was from Zimmer, and we used to have these, dinner meetings, and the number of people we had there were four. One of them was my mom. The other one was my wife. So that's how bad that was. Now you're at, an academy meeting and it's jammed. There's standing room only there, which really means that, this is coming to fruition of what we really envisioned this to be. But I think a key thing now too is also to make sure that we don't oversell this, that this is for specific indications. And that's what you're trying to do. And not only doing that, but you're addressing all the parts, because if you have other problems going on, this isn't going to cure all the problems. You have to address all those other issues. And you had a very good little video on that talked about like this trilogy of prolotherapy, orthobiologics, and precision delivery. Why don't you talk to us a little bit about how your vision of how this should be delivered?
Yeah, when I first got involved in this, it was because I had an interest in musculoskeletal medicine. I had an interest in some of the image guidance. But the reality is, to really put this together, I think to properly professionalize what we're doing, it's really looking at what are the three things it takes to be a master in regenerative medicine. And I think it takes a dedication, understanding of prolotherapy, dedication, understanding of orthobiologics, and really an expertise in image guidance or interventional orthopedics. The prolotherapy aspect is a couple things, but number one, it's do you understand musculoskeletal medicine, right? I mean, this can't be something that you're dabbling in. I mean, if you're treating someone who has a knee problem or shoulder problem, you should really be focused on treating knee and shoulder problems. I mean, you shouldn't be doing gynecology on one end and treating some skin issues on the other end, and then in between you're treating a couple of knees and shoulders. That's not what I would want. I think you really have to be dedicated to understanding what is pathology, what is the three-dimensional nature of the musculoskeletal system. Because when it comes to treating something like a knee, it's not just what's wrong with the knee, it's what's wrong with the back, the ankle. It's really thinking about that whole person. The prolotherapy perspective is interesting because it's been around for decades, and it's about treating not just, let's say, a knee joint, it's treating everything else that's causing that degenerative process, whether it's ligaments, soft tissue structures. Again, if there's alignment issues, if there's a back issue, it's treating everything. So that's got to be number one. And I think people who come from that traditional musculoskeletal training, they get that already. Yeah. The advantage of the prolotherapy kind of perspective is then you're also treating those other things that you're already thinking about. Number two is definitely the orthobiologics part. You can't think of these treatments as strictly interchangeable. I think colleagues that I'm most interested in talking to are the ones who get involved in the minutia of all this. So, hey, I'm using this type of platelet-rich plasma, this concentration with this no red cells or more red cells for arthritis versus tendonitis versus muscle issues. Am I using platelet-poor plasma? Am I using platelet lysate? They obsess about things like, what's my technique for bone marrow aspiration draw? How many sites do I have to hit? What's the device that I use? I mean, they're obsessed about the minutia, but you have to be that if you want to be an expert in something. And then lastly, I think the image guidance is really key. I think the days of just strictly injecting into a knee joint, a shoulder joint blindly, I think those are gone in general. They have to be. But from an orthobiologic standpoint, a regenerative medicine standpoint, if someone comes in with a knee problem, a degenerative knee problem for 10 years, it's not just, hey, let me just inject cells into the knee joint. It's where's their instability? Let me treat the ligaments that are unstable. There's a technique to inject an ACL. In a lot of these patients, they have a lax ACL. That takes a really high level of X-ray and fluoroscopic guidance. Or in a lot of these patients, you find that they do have swelling in the bone. You need to inject cells into the bone. Again, you can't do that blindly. You have to do it under appropriate imaging guidance. So to me, this is becoming a proper professional field. And it's those three things, big picture, that I think a person has to be able to master.
Yeah, and that's a really good summary. And I think you're right on to things about anatomy. I think that this should be delivered by physicians that master anatomy. I came from a DO perspective. My father was also an orthopedic surgeon. And they used to say, look, when you start off medical school, there's basically three classes you got to take. It's anatomy, then you have lunch, and then you do anatomy. So, because everything relates back to anatomy at the beginning, but then you have to add in these other things. And I think this is a great perspective that you have. So, you also talked about being obsessed, and that made me think about some great artists in the past too. Other people that we look up to that are artists, that were leaders in the field, and they had an obsession. And sometimes that obsession was unhealthy, but they were obsessed. And I got to tell you, I'm that way too. I read everything. I mean, I stay up until at least midnight every night, just reading everything, down that rabbit hole, reading everything. And it just stimulates you to learn more and to try to do it better. And I would say every single case that I do, I look back and I say, what could I have done to make that better? How could I have made that bone marrow aspirate a little bit better? How could I have made that delivery a little bit better? My view of that tendon on the ultrasound was not exactly what I wanted to see, but and how can I guide that better? And you look back at some great artists that they're looking for that right beat, they're looking for that right note, and they will keep going over and over and over and over again until they get it perfect. And so I think that is something that's needed in this profession. Like, it's not just good enough, it's got to be better. So I think that's a good philosophy to follow.
It's interesting. I think I think for physicians to put out content, one of the interesting things that I think the general public can learn about is that is our approach, in the sense that our training is really all about if you've done something, you analyze, you reanalyze, you go back, you kind of obsessively go back to figure out how can you do things better. One of the exciting things, I think probably one of the most exciting things about a physician, about the work that we do is we know for a fact that everything that we're doing now, we're giving 100%, doing our best, but we know in 5 years, 10 years, we're going to be light years ahead. That's the exciting thing about the nature of what medicine is. I think regenerative medicine is that version, sort of exponentially higher, in the sense that the science and the clinical part is just exploding. But a little bit of obsession is a good thing.
I hope you're liking Profiles in Cellular Healing. If you do like it, like us on Facebook, or if you have a question, go ahead and give us a question. We'll be more than happy to answer them for you. Because remember, these are your cells for your healing. Yes. And, just thinking about the progression of other things in medicine. When I was in college, my father took me in the OR, and they were doing a meniscal repair. And he was really excited about taking blood and stirring it with a glass rod and making a piece of snot that, for some reason, I don't know how he did this, but he looped snot, dragged it into the knee, and placed it right at the repair. And that was the orthobiologics at the time, where we just went ahead and stirred blood in a glass flask with a glass rod, and the calcium that was from there caused the clot. But now we've progressed much further understanding this. And this brings us to the next topic, which I think is really good, is to talk about quantification. Just like when we give somebody an aspirin, we know that's supposed to be 81 milligrams in that baby aspirin. Well, right now we kind of have an idea, but we don't really quantify that. So I don't know if you have some thoughts about, and right now, in my obsession of working through things, we've come up with a predictive model that can predict things of what that quantification is. How many cells do we actually give you? And trying to find out what that optimal amount is. And I know you've talked about that with platelets.
Yeah, I mean, it's interesting. There's so many variables to a treatment, and we obviously need to get a better sense for how do we actually quantitate things, what measurement of platelets versus other cells. Something that we regularly do in the clinic now is we're measuring out cell counts in a bone marrow aspirate. I think there's reasonable data there to suggest what kind of gives a better result. I think in platelets, there's a little bit more variability in the sense that you sort of need to know what a person's own serum blood platelet level is, and how often is that being checked on the same day, the same moment that you're actually creating their platelet-rich plasma as well. But to me, that's obviously a significant part of this, about what gives us more information about best practices and best products to use for given indications. I think we're developing that already. We know that for joints, higher concentration of platelets is definitely better than lower concentration. For tendons, there's some data now to say that higher concentration is still okay, that it's not necessarily toxic. It's actually better than lower concentration. But I think some of that is still evolving, but compared to where we were, 15 years ago, it's light years ahead. I was thinking about your story about the dentist. When I first got interested in PRP, I did contact a dentist who I'd read something where he had talked about creating PRP. And when I originally got interested, talking to veterinarians who are treating horses, that they knew more about this than any of us. But it's an interesting thing that to take it from where an orthopedic surgeon a couple of generations ago, your dad, saw the value in what this could be, and that we're still sort of in that realm. And some level we've grown a lot, and in some level there's still some wisdom from those prior generations. Yeah. That it's nice that we're still connected to that.
Yeah. And just as a reminder here, we're with Dr. Siddharth Tambar from the Chicago Arthritis and Regenerative Medicine Clinic. He's at chicagoarthritis.com. So I don't want you guys to lose a perspective of where you can get some really good regenerative medicine treatment in the Chicago area. And, just kind of summarize up right here. You talked about that there's 4 questions that a physician goes through in his mind when deciding upon a treatment protocol, because in a pure sense, we would all like to see level 1 evidence, which is a double-blinded, randomized, prospective, controlled trial. But in real life, that's not how real life works. And even in those trials, there are quite a bit of patients that actually fail treatment. So that doesn't mean that following that level 1 trial means that that's the best thing for you. And I think this is where the art of medicine comes in and where you combine things. So why don't you go over some of those parameters that you brought up, which I think is another good insight on regenerative medicine.
Yeah, it's a fascinating thing that medicine is really, it's such a practical science, and it really is blending art and science together. On one level, we're always asking, okay, what does the data show? What does the evidence show on a big level? What are my colleagues doing that's working? So really extrapolating and taking evidence-based information and trying to affect what our practice is. There's another level, though, which really is, what are we doing for this patient sitting in front of me right now? And you have to blend those two things together. Because the reality is that even when you have data and really big picture quantified information about here's best practices, human beings still respond differently from one to another. And there's always going to be a personalization to treatment when it comes down to it. And so it's an interesting balance of trying to take what is most current, most proven, but the reality is so much is not proven, so much is unknown. And patient X might seem like they're a really good candidate because they have X, Y, and Z. But when you actually kind of get to some of the details, you say, look, in my experience, in my colleagues' experience, there may be different types of challenges, and we have to personalize things and alter things a little bit more. But that's obviously some of the more interesting kind of art based on what we're doing every single day in the clinic. But there is that constant sort of balancing of what does the big picture evidence say versus what am I doing for this individual right now?
Yeah. And I think that's where that term, the art of medicine, comes in, is that you just can't treat a patient as a study, as somebody who's in a study. Again, because even in that study, there's a certain percentage that do not respond. So you have to look at that person as a whole and figure out what's the best treatment for this patient in this situation. And it may change the next patient you see, it may be totally different. And I think that's where your experience comes in. You've had a lot of experience in this, and that brings up, our final point here about experience does count, meaning that people that obsess over this, that they have a lot of experience, they want to get it better. This is just not a hobby. This is an obsession. And I think you have that obsession. I can tell it in your voice. I can tell about it in your videos that you put out. And if you are in the Chicago area, that Chicago Arthritis and Regenerative Medicine Clinic, it looks like you're revamped it, or I noticed the other day you just put a new lobby in, or.
No, so we moved. I mean, we
Or,
moved from a smaller space to we moved from a 1,500 square foot space to a 6,000 square foot space.
wow.
In large part because we need to grow, we need to do things at that higher level. Getting back to that sort of art of medicine, it's interesting because at some level, as a physician, you're balancing what is intellectually, scientifically appropriate based on your training, based on your reading. You're balancing what's going on with this individual patient. And really at the heart of it, it's if this were my mother, if this were my sister, if this were my wife, if this were my son, what would I do? And I think that's what really creates, that's what really humanizes what we're doing. Because end of the day, it is definitely about how can I get the best outcome for this person, but it's how can I actually improve the life for this human being. And there are plenty of times where you see someone who wants to be treated and you say, look, if you were my mother, I would probably have you go see a surgeon at this point. That's the right thing for you. And that it's an interesting balance that we have, that it is an intellectual, a professional thing. It is a personal thing with that person as well. But really at the core of it, it is very much, how do I help this human being in the same manner that I'd want to treat my own family, which I think is kind of interesting. And I think patients definitely obviously appreciate that, but it creates a level of, I think it creates more meaning and humanity to what we're trying to do every single day, that it takes it from being sort of humdrum, everyday grind stuff to really elevating it to something that's worthwhile, your life and your time.
Yeah, I agree with you. It's one perspective I have is, and like I was telling you before, I came from the restaurant industry and welcoming people. And the best thing there was to welcome them into your home. And so I still take that to our clinic, that you're coming into my home. So I'm treating you as family because now you're in my home. You're in my office right now. So we're going to treat you with the dignity that I treat my family. Hopefully I treat them with a lot of dignity. But yes, and that is true because we don't want to do harm. We only want to make this area of medicine grow. And if we're not giving patients 110%, if we're not choosing for them what is really the best for them and not what's the best for us, we're not doing anybody a favor. So with that, this is Dr. Siddharth Tambar again. He's at the Chicago Arthritis Regenerative Medicine Clinic at chicagoarthritis.com. If you're in Chicago, it might be worth visiting him and understanding how he can welcome you into his own family and treat you with the dignity that you need to be treated with. So Remember, these are your cells for your healing, and we'll see you next time on Cellular Healing. Take care. Thanks for joining us on Profiles in Cellular Healing. Don't forget to go ahead and like us on Facebook or subscribe to us on YouTube. Or you can go ahead and contact us through cellularhealing.net. Remember, these are your cells for your healing.